You know the routine better than you want to. You finally fall asleep. And then an hour later, 2 hours later, sometimes 3 or 4 times between midnight and morning, your bladder drags you back into the cold and the dark. You shuffle to the bathroom half awake, return to bed, stare at the ceiling for 20 minutes, and start the whole cycle over again. By morning, you feel like you never really slept at all. And the doctors have told you, and this is just what happens when you get older. This is normal. This is something you learn to manage. I am going to tell you something different today, and I am going to back it up with the biology. My name is Dr. James Mercer. I'm a board-certified physician with 35 years of clinical practice and over 40,000 patients treated. And I want to tell you plainly that what I just described, waking 2, 3, 4 times every night to urinate, is not simply aging. It is a condition with a name, a mechanism, and in the majority of cases, a set of natural interventions that most doctors never take the time to explain. Today, I am going to explain them, all of them, starting with a specific bedtime drink protocol that I have recommended to patients for years, and that is backed by peer-reviewed clinical research. Stay with me, because tonight can be different. The medical term for what you are experiencing is nocturia, and I want you to understand how extraordinarily common this is among people your age, because the first thing most seniors feel about waking to urinate at night is shame or resignation, and neither of those responses serves you. Research published in 2025 reviewing the current clinical landscape found that more than 70% of individuals aged 60 and older report problems with nocturia, with more than 1/3 of them needing to rise 2 or more times per night. A separate clinical review from the NIH found that for patients aged 80 and older, the prevalence of nocturia rises to between 80 and 90%. This is not a personal failure. It is one of the most widespread and most undertreated conditions in the entire senior population. And here's the part that should make you genuinely angry on behalf of yourself and every person over 60 you know. The same clinical literature that documents how devastatingly common nocturia is also documents how devastatingly underreported and undertreated it is. Most seniors do not mention it to their doctor because they believe it is inevitable. Most doctors do not ask about it because there is not a quick fix they can offer in a 15-minute appointment. And the result is a generation of older Americans accepting a severe chronic disruption to their sleep, a disruption that research has linked to daytime cognitive dysfunction, symptoms of depression, social withdrawal, a 1.8-fold increased risk of dangerous falls and hip fractures, and in men who arise more than 3 times per night, a documented 2-fold increase in mortality compared to men with fewer nocturnal episodes. Let that sink in. The nightly bathroom trips that everyone told you were just part of getting older are associated with that level of consequence, and still, most patients are sent home with nothing more useful than the advice to drink less water in the evening. I'm going to give you something far more useful than that today. Before I tell you what to drink, I need to make sure you understand why nocturia gets dramatically worse after 60, because the biology behind it is not simple, and it is not just about the bladder. There are at least 3 separate physiological mechanisms converging in the aging body that explain why so many seniors spend their nights walking the hallway to the bathroom. And understanding all 3 is what makes the difference between treatment that actually works and treatment that addresses only one piece of the puzzle. The first mechanism is called nocturnal polyuria, and this is the one that is most frequently missed in standard clinical practice. Nocturnal polyuria is a specific syndrome where the normal ratio of daytime to nighttime urine production becomes reversed. In a healthy adult, the kidneys produce roughly twice as much urine during the day as they do during the night. The hormone responsible for this night-to-day ratio is called antidiuretic hormone, ADH, also known as vasopressin. A DH tells the kidneys to reduce urine production during sleep. In a young person, ADH levels rise naturally as night falls and decline again in the morning. Your kidneys receive the signal, they conserve water, urine production slows, and you sleep through the night. After 60, this hormonal signaling system begins to lose its precision. A DH production declines. The kidney sensitivity to ADH diminishes. And the result is that the kidneys produce excessive urine at night, sometimes nearly as much as they produce during the day. Your bladder fills in the night hours the same way it fills during waking hours, and no matter how well you manage your fluid intake in the evening, if the underlying ADH mechanism has become dysregulated, you will still wake up. Because the problem is not how much you drank. The problem is what your kidneys are doing with the fluid while you sleep. The second mechanism involves what I call the gravity redistribution effect, and I need you to picture this clearly. Many seniors develop mild to moderate fluid retention in their lower legs and ankles during the day. Sometimes this is caused by cardiovascular inefficiency, sometimes by venous insufficiency, sometimes by the simple act of sitting for long periods. During the day, that fluid pools in the soft tissue of the calves and ankles, held there by gravity. You see the swelling. You feel the heaviness in your legs by late afternoon. But when you lie down at night, gravity no longer holds that fluid in your legs. It is reabsorbed into circulation. Your cardiovascular system processes it. It travels to the kidneys, and your kidneys excrete it as urine. In the middle of the night, repeatedly. This is one of the most underappreciated contributors to nocturia in the senior population, and it explains why some of the most effective interventions for nighttime urination have nothing to do with the bladder at all. The third mechanism involves the bladder itself. With aging, the smooth muscle of the bladder wall undergoes structural changes. The muscle becomes less elastic and less able to accommodate large volumes without triggering the urge to void. The bladder that once held 400 to 500 milliliters without distress may now signal urgency at 200 milliliters. The nervous system sensitivity of the bladder wall also changes with age, generating false urgency signals that wake you even when the volume present is not physiologically necessary to expel. And in men, benign prostatic hyperplasia, the non-cancerous enlargement of the prostate gland that affects the majority of men over 60, creates outlet obstruction that compounds bladder overactivity and urgency significantly. Three separate mechanisms, three separate pieces of the puzzle, all converging on the same result: multiple trips to the bathroom per night, disrupted sleep, daytime fatigue, cognitive fog, the slow, relentless accumulation of a sleep debt that no morning coffee can fully repair. Now, let me tell you about the bedtime drink and the reason it works for all three mechanisms simultaneously. The drink I am going to give you is built on two natural ingredients that have been studied in clinical research specifically for nocturia and sleep quality in older adults: tart cherry concentrate and magnesium dissolved in warm water. Together, these two ingredients address the hormonal, muscular, and neurological dimensions of the nocturia problem in a way that no single pharmaceutical agent manages to do without the side effects that make most senior patients miserable. Let me explain tart cherry first. Tart cherries, specifically the Montmorency variety, are one of the highest naturally occurring dietary sources of melatonin found in any food. Melatonin is the hormone your brain's pineal gland produces as darkness falls, signaling to every organ system in your body that night has arrived and sleep should begin. But melatonin does not only influence sleep onset, it also plays a direct role in bladder function through a mechanism that most people have never heard about. Research has demonstrated that melatonin increases bladder capacity through pathways involving GABA, the brain's primary inhibitory neurotransmitter. GABA receptors in the bladder wall respond to melatonin signaling by relaxing the detrusor muscle, the smooth muscle that contracts when the bladder needs to void. When that muscle is more relaxed, the bladder can hold a larger volume without triggering the urgency response. And when the urgency threshold rises, the number of times you wake up during the night decreases. Additionally, melatonin influences vasopressin signaling. Melatonin has been shown in animal research to increase bladder capacity through decreasing urine volume via vasopressin-related pathways, meaning melatonin does not only help your bladder hold more, it may also help signal the kidneys to produce less urine at night. Both mechanisms working together. One hormone addressing two of the three mechanisms I described. A randomized controlled trial published in the Journal of Urology in 2022 evaluated the effects of 2 milligrams of prolonged release melatonin taken at bedtime in elderly women with nocturia. The finding was significant. Melatonin reduced nocturia episodes by approximately 1 per night compared to placebo. The first uninterrupted sleep period also increased significantly. An earlier trial in men with benign prostatic hyperplasia found similar results at the same dose. A systematic review published in Neurology and Urodynamics in 2024 confirmed that while the overall trial base is still growing, the existing evidence shows genuine promise for melatonin as a natural nocturia intervention with an exceptionally safe profile. And a systematic review of tart cherry research published in the journal Food Science and Nutrition in 2025 analyzed 7 clinical studies examining the effects of tart cherry on sleep quality and duration. 3 of those studies reported significant improvements in sleep duration, sleep efficiency, or sleep onset time. 3 studies also reported measurable increases in melatonin levels following tart cherry consumption. And 2 studies documented decreases in inflammatory markers, including C-reactive protein. A pilot study of 15 older adults with chronic insomnia who consumed tart cherry juice for 2 weeks reported significant improvements in sleep quality, sleep latency, and insomnia severity compared to baseline. The reason tart cherry is superior to a standard melatonin supplement for this purpose is the accompanying compound profile. Tart cherries contain not only melatonin, but also tryptophan, the amino acid precursor to serotonin, which is then converted to melatonin in the brain. They contain anthocyanins, potent anti-inflammatory compounds that reduce systemic inflammation, including bladder wall inflammation that contributes to urgency. And they contain a naturally occurring form of melatonin that appears to be processed by the body in a more sustained, gradual manner than a synthetic supplement tablet. The result is a slower, smoother rise in melatonin levels that more closely mimics the natural nocturnal melatonin curve your body is supposed to produce. Now, let me tell you about the second ingredient, magnesium, and specifically magnesium glycinate dissolved in warm water. Magnesium is involved in over 300 enzymatic reactions in the human body. But for the purposes of tonight's bedtime drink, the mechanisms that matter most are 3. First, magnesium is the primary regulator of smooth muscle relaxation, the detrusor muscle of the bladder. The muscle that contracts to trigger the urge to void is a smooth muscle. Studies examining magnesium supplementation for overactive bladder have found that magnesium's smooth muscle relaxation effect directly reduces detrusor muscle overactivity and urgency frequency. Your bladder becomes physiologically calmer when adequate magnesium is present in the body. Second, magnesium directly regulates the production of cortisol, your primary stress hormone. Elevated nighttime cortisol is one of the most common drivers of disrupted sleep architecture in seniors. When cortisol remains high during the night, which it does in people who are chronically sleep deprived, chronically stressed, or nutritionally deficient in magnesium, the brain cannot complete the deep, slow wave sleep stages where the body does its most important repair work. Magnesium acts as a physiological brake on the cortisol system, supporting a quieter nervous system environment during sleep. And a calmer nervous system is less likely to generate the false urgency signals from a sensitive bladder wall that wake you unnecessarily. Third, magnesium regulates the production and release of melatonin itself. Magnesium is required as a cofactor for the enzymatic conversion of serotonin to melatonin inside the pineal gland. In the estimated 50% or more of American adults over 60 who are deficient in magnesium, the pineal gland cannot produce adequate melatonin, even if all the other conditions are right. This means that for a significant proportion of the seniors experiencing nocturia, the magnesium deficiency itself is partially responsible for the ADH dysregulation and the melatonin insufficiency driving their nighttime bladder problem. The bedtime drink addresses this directly. The form of magnesium matters enormously for this purpose. Magnesium oxide, the cheapest form found in most supplements, is poorly absorbed and primarily acts as a laxative. Magnesium citrate is better absorbed but can still cause loose stools in sensitive individuals. Magnesium glycinate is the form I recommend for senior patients specifically. It is bound to the amino acid glycine, which dramatically improves absorption across the gut wall in people over 60 whose digestive efficiency has naturally declined. Glycine itself has independent calming and sleep supporting properties, and magnesium glycinate does not cause the GI disturbance of the other forms. Here is the exact bedtime drink protocol, starting tonight, approximately 1 hour before you intend to sleep, and this timing is important. You are going to make the following preparation into 8 ounces of warm water, not hot, warm, the temperature of a comfortable bath. You are going to dissolve 1/2 teaspoon of magnesium glycinate powder. Most health food stores and online retailers carry magnesium glycinate in powder form, specifically designed to dissolve in water. If you can only find capsules initially, open 200 milligram capsules and dissolve the contents. Total target dose is 300 to 400 milligrams of elemental magnesium glycinate. To that same glass, add 1 tablespoon of tart cherry concentrate, not tart cherry juice from a large bottle that has been diluted and sweetened. Tart cherry concentrate, a dark syrupy liquid sold in small bottles specifically labeled as concentrate. This is the form used in the clinical research showing melatonin elevation and sleep improvement. 1 tablespoon of concentrate in 8 ounces of warm water provides the equivalent melatonin and anthocyanin profile studied in the clinical trials. Stir until dissolved, drink slowly. Do not gulp this. You are not trying to hydrate. You are delivering a specific set of compounds at a specific time for a specific biochemical purpose. Drink it over 5 to 10 minutes. This is step 1. But the drink alone is only part of the protocol, because even the best bedtime drink cannot fully compensate for the gravity redistribution effect I described. You need to address the leg fluid problem before you lie down, and here is how. Step 2 is the leg elevation protocol. For the 2 hours before bed every evening, I want you to lie back in a recliner or on the couch with your legs elevated above the level of your heart. Use pillows to prop your legs up if you do not have a recliner. This deliberate pre-sleep leg elevation uses gravity in reverse to begin draining the fluid from your lower legs back into general circulation before you go to bed. Your kidneys process this fluid during your waking hours rather than at 2 in the morning. The nighttime urine production that was being generated by fluid redistribution during sleep is shifted to earlier in the evening when you are already awake and handling it. Multiple clinical guidelines on nocturia management identify afternoon and early evening leg elevation as one of the most effective behavioral interventions for nocturnal polyuria in the senior population. Combine leg elevation with a 15-minute gentle walk in the afternoon. Calf muscle contraction during walking acts as a mechanical pump for the venous circulation in the legs, actively moving stagnant venous blood and interstitial fluid back toward the heart and kidneys. Patients who walk daily in the afternoon and elevate their legs in the evening before bed consistently report meaningful reductions in nighttime urination frequency. This is not a side note. In clinical practice, this behavioral combination is often as effective as pharmacological interventions, with 0 side effects and 0 cost. Step 3 involves what you are wearing on your legs during the day. If you have any visible ankle or leg swelling by afternoon, and many seniors do, I want you to wear compression stockings during your waking hours. Compression stockings apply graduated pressure to the legs that prevents interstitial fluid from accumulating in the calf and ankle tissue throughout the day. Less fluid accumulates during the day. Less fluid redistributes at night. Less nighttime urine is produced. Clinical guidelines for nocturia management in the elderly consistently identify compression stockings as a first-line non-pharmacological intervention. You can find them at any pharmacy. The compression level of 15 to 20 millimeters of mercury is generally appropriate for most seniors without significant cardiovascular disease. If you have peripheral artery disease, check with your physician first before wearing compression garments. Step 4 concerns something that most seniors have never connected to their nighttime bathroom trips: the timing of your diuretic medication. If you are taking a water pill, furosemide, hydrochlorothiazide, bumetanide, or any other diuretic for blood pressure or fluid management, and you are taking it in the afternoon or evening, That medication is deliberately making your kidneys produce more urine at precisely the window when you want them to produce less. Take your diuretic with breakfast. Take it before noon at the absolute latest. Clinical guidelines are clear on this. A diuretic taken more than 6 hours before bedtime will complete most of its effect before you go to sleep. A diuretic taken at dinner is going to drive you to the bathroom at midnight and again at 3. This single timing adjustment has changed the nighttime experience for many patients I have treated. Ask your doctor or pharmacist today about shifting your diuretic timing to the morning. Step 5 addresses the bladder itself through pumpkin seed. Pumpkin seed extract has been studied specifically for overactive bladder and nocturia in several clinical trials. It contains a combination of magnesium, zinc, phytosterols, and compounds that inhibit the 5-alpha reductase enzyme, the enzyme involved in prostate enlargement in men. Pumpkin seed compounds relax smooth muscle in the bladder wall and reduce urgency by directly influencing the muscle tone of the detrusor. One clinical study of 60 men over 3 months showed that pumpkin seed extract supported urinary health and reduced frequency. A study published in the Journal of Traditional and Complementary Medicine found that pumpkin seed oil extracted from Cucurbita maxima improved urinary disorder in people with overactive bladder. In one small but carefully conducted study, participants taking pumpkin seed supplements reported significant reductions in urgency, frequency, and nocturia after both 6 and 12 weeks of consistent use. I recommend adding 1 tablespoon of raw pumpkin seeds to your afternoon meal daily as the most natural delivery method. For more precise dosing, a standardized pumpkin seed extract supplement is available in most health food stores. Step 6 is the one most seniors never hear about in a doctor's office. Bladder retraining. Your bladder has a learned urgency pattern. Over years of getting up every time you felt the slightest twinge of urgency, your bladder has been trained to signal early and often. The goal of bladder retraining is to gradually extend the interval between voiding events, teaching the bladder that it can hold larger volumes without crisis. During daytime hours, when you feel the urge to urinate, delay it by 5 minutes, sit down, breathe slowly and deeply. Contract your pelvic floor muscles. The urge will often pass or diminish. Next week, extend the delay to 10 minutes. Over 4 to 6 weeks, many people can increase their functional bladder capacity meaningfully by retraining the urgency response. This neurological retraining carries over into nighttime behavior. A bladder that has learned to hold more during the day holds more during the night. Now, let me tell you what most doctors working inside the pharmaceutical model of care have never been incentivized to tell you about nocturia. The standard pharmaceutical approach to nocturia involves anticholinergic medications for overactive bladder and, in severe cases, a synthetic ADH analog called desmopressin. The anticholinergics, drugs like oxybutynin, tolterodine, and sulfonacin, work by blocking the muscarinic receptors in the bladder wall that trigger detrusor contraction. They do reduce urgency and frequency for many patients. But in people over 60, anticholinergic drugs carry a risk profile that I consider frankly unacceptable without exhausting natural options first. Multiple large studies have linked chronic anticholinergic use in seniors to accelerated cognitive decline, confusion, dry mouth, constipation, and an increased risk of developing dementia with prolonged use. The very population most vulnerable to those side effects is the one being most aggressively prescribed these medications. Desmopressin, the synthetic vasopressin analog, is effective for nocturnal polyuria, but it carries a serious risk of hyponatremia, dangerously low sodium levels in the blood in elderly patients. The FDA has added specific warnings about this risk for patients over 65. And yet desmopressin is widely prescribed for this population without adequate monitoring. I am not saying never use medications. I am saying that the natural protocol I have just described addresses the same physiological mechanisms through safer, better tolerated, less costly means. Magnesium, glycinate, and tart cherry concentrate for the melatonin, vasopressin, and detrusor muscle relaxation mechanisms. Leg elevation and compression stockings for the nocturnal polyuria from fluid redistribution. Morning diuretic timing timing for medication-driven nocturia, pumpkin seed for bladder smooth muscle support, bladder retraining for the neurological urgency pattern. These are the interventions that should be tried first, consistently, completely. Before an elderly patient is handed a prescription that may take something from their brain while giving something back to their bladder. Now, let me walk you through 3 futures, and I want you to sit with each one. In the first future, you hear all of this in the inertia of the familiar winds. Tonight, you go to bed the same way you went to bed last night. The bathroom trip at 1 a.m. happens. The one at 3 a.m. happens. The one at 5 a.m. happens. Tomorrow morning, you are tired, foggy, and slightly more convinced that this is simply your life now. The cumulative sleep deficit that nocturia has been building in your body for months or years continues its quiet damage. The cognitive fog that comes from chronic fragmented sleep continues to deepen. The fall risk that rises with each nocturnal trip in a dark, disoriented state remains unchanged. In the second future, you try part of the protocol. You make the bedtime drink for a few nights, but forget to do the leg elevation. You buy the magnesium, but not the tart cherry concentrate. You intend to shift your diuretic to the morning, but forget to mention it to your pharmacist. Each individual piece has a partial effect. You notice a small improvement and then plateau. And because the full synergistic effect of the combined protocol was never achieved, you conclude that it sort of works, but not enough. In the third future, you start tonight. You make the tart cherry and magnesium glycinate bedtime drink 1 hour before sleep. Tomorrow, you begin the afternoon leg elevation routine. This week, you speak to your pharmacist about shifting your diuretic timing. You add pumpkin seeds to your afternoon meal. You begin the gentle daily walk. And at the end of 7 nights, you notice something has changed. The 1 a.m. trip did not happen. You slept until 3:30. You returned to sleep easily. The next morning, you felt like a version of yourself you had almost forgotten. That is not a fantasy. That is what the biology of the protocol is designed to produce. Tonight is available to you. The ingredients are available today. The only thing that has been missing is the information. Here is my direct medical opinion. Nocturia is not something you are supposed to accept without a fight. It is not an irreversible feature of aging. It is a condition with biology behind it, and biology responds to the right inputs regardless of your age. I have watched patients in their 70s implement this protocol and describe sleeping through the night for the first time in years. I have watched senior patients come back to my practice with tears in their eyes telling me they had forgotten what it felt like to wake up rested. That experience is what drove me to keep practicing medicine for 35 years, and it is what drives me to bring this to you today. Before you go, I want to know in the comments, how many times per night are you currently getting up to urinate? And has any doctor ever talked to you about the specific causes of nocturia or offered you anything beyond drink less water at night? Tell me below. I read every comment. Your answers guide this channel. If this gave you something real today, something you can start using tonight, and hit subscribe right now, because every single week I come back here with the kind of medical conversation that your health deserves. Next week, I am going to reveal a specific warning sign in your morning urine that most seniors completely ignore. But that can be an early indicator of 3 serious conditions that are fully reversible when caught at this stage. You will not want to miss that one. I am Dr. James Mercer. You deserve to sleep through the night. Starting tonight, I will see you next week.